This is Frequently Asked Questions about Natural Migraine Relief for Women. Episode 17, Exercise and Migraine, Preventive, Provocative, or Both? This is part 1. Hi, this is Jeff Baker, your host for Frequently Asked Questions about Natural Migraine Relief for Women. Today's episode addresses a habit we should all have and one that can affect headaches in 1/3 of those with migraines. As I survey the popular and scientific literature, I find few migraine-related factors with as many variable options as that of the role of exercise in causing or preventing migraines. Why is this? At the risk of sounding repetitious, it traces back to understanding which root cause factors provoke your version of migraine and how exercise can either calm or aggravate each root cause that may apply to you. I'd like to review 6 of these general areas of impact as they affect exercise. Given the volume of this information, I'm going to address 3 of these factors in this episode and the other 3 in next week's FAQ, episode 18. Each of these factors has standalone applications that you can apply in discerning what version of an exercise plan may work best for your own migraine story. I'll include action plan ideas for each of them, and then we'll summarize them at the end of each article. The root cause interactions with exercise we will address in 2 parts include Episode 17, Part 1, Exercise, Blood Flow, and the Role of Nitric Oxide, Exercise and the Neurochemistry of Migraine, and Exercise and the Role of Sleep and Rest. The upcoming Episode 18, Part 2 will include exercise and metabolic factors in migraine, exercise and female hormone balance, and exercise and fitness level in migraine expression. Please keep in mind that we could easily fill each section with 15 to 20 pages of discussion and documentation. For the sake of brevity, I will stay as focused, brief, and to the point as possible. Let's begin Part 1 with exercise, blood flow, and the role of nitric oxide. The molecule nitric oxide, or NO, production increases in skeletal muscle and endothelial cells in response to physical activity. It assists in dilating arteries and veins, increases blood flow in the brain, and can also sensitize pain receptors. Through these mechanisms, excess nitric oxide has been known to cause migraines. NO, however, is not the sole factor in this migraine connection. It is as much or more the oxidation or breakdown damage of NO to something called peroxynitrite, chemical symbol ONO, isn't that just ironic, that is a major culprit in promoting a migraine. Migraine patients have a higher peroxynitrite (ONO) load than other people. A combination of extra nitric oxide and then additional stress factors which oxidize NO to ONO can push your migraine buttons. For most people, exercise doesn't cause headaches. This can also be true for some with migraines, but if you make extra nitric oxide and 2 have enough stressful oxidation to make excess ONO, you may cross the migraine threshold much more readily during or after exercise. An excess of the ONO or peroxynitrite is also associated with symptoms of chronically cold hands and feet, inflammation of all kinds, headaches and migraine headaches, sore joints and muscles, more readily bruising, depression, lack of motivation, fatigue, as well as an inability to sleep even though chronically tired, feeling anxious and irritable, having poor memory or lack of focus and attention, or feeling lightheaded when you stand up. If you have these symptoms, especially migraines, and exercise at times worsens your situation, you should consider the following measures. A. Minimize factors boosting your nitric oxide level. This includes the amino acid supplements that include arginine and citrulline, which promote nitric oxide production. Also avoiding medications that augment nitric oxide, such as nitrates and the Viagra type prescriptions. This can also include the drug amlodipine, a common drug typically used for hypertension. Also, avoid exercise that is excessively intense, especially for your level of fitness. Consider a gradual warm-up, shorter sessions, lower intensity, and more recovery time between sessions until you find the sweet spot between making fitness progress and avoiding headaches related to excess nitric oxide production. You can also reduce excess nitric oxide by B, recognizing that times of excess physical, emotional, or situational stress may require reducing your frequency or intensity of exercise to minimize provocations of migraine. You can then phase back up when the stressors fade back to baseline levels. And C, consider taking nutrients that can reduce those ONOs and their downstream effects. There are many that contribute in this area, but my favorites include curcumin, optimal levels of vitamin D, and the antioxidant astaxanthin. Let's now go on to talk about another root cause factor where exercise can promote migraines, and that would be exercise and the neurochemistry of migraine. Exercise is well known for raising brain chemicals like dopamine, serotonin, endocannabinoids, and endorphins that contribute to reduced stress and anxiety, a sense of joy, improved mood, and self-confidence, along with better sleep quality and sharper cognitive function. Optimal levels of these neurochemicals can reduce migraine expression and improve your recovery after a headache event. Multiple studies have shown that regular exercise reduces migraine frequency. Within this category, I'd also like to mention two more recently described brain migraine connections and the exercise and cerebral blood flow connection. A. It has been found that for some, exercise increases the release of the calcitonin gene-related peptide, known as CGRP, that is known to provoke migraines. Around one-third of those with migraines find that exercise can be a precipitating factor, and we don't know if the two are related, but it is interesting to note that roughly one-third of those with migraine respond well to CGRP blocking medications. It would be reasonable to consider that if your exercise leads to a headache, you might be a good candidate to try one of the newer drugs that block the CGRP pathway and allow you to exercise without headache pain. If this sounds like your story, check out this option with your primary care or neurology physician. Another neurochemistry relationship between exercise and migraines is hypocretin. This is a neurohormone produced by the hypothalamus in the brain. Now, right now, you can't check this level with routine blood work, but research studies have shown that impaired hypocretin pathways have been found in subjects with migraine. This has been associated with symptoms preceding a migraine attack, such as excessive sleepiness, food cravings, yawning, and fatigue. Some studies have found that vigorous exercise could influence the hypocretin pathway and theoretically initiate attacks. If you have the above mentioned symptoms before your migraine, you might limit the high intensity aspects of your exercise sessions for the following 1 or 2 days to be helpful in mitigating the onset of a migraine. Speaking of high intensity, an intense exercise session can result in an exaggeration of increased cerebral blood pressure and blood flow. For some, this can be a promoting factor for migraine, and if this holds true for you, consider staying within aerobic threshold for your exercise, which would be a heart rate no higher than 60 to 80% of what we call your predicted maximal heart rate. When you're doing strength training, using less weight but doing perhaps a few more reps with good form and a breathing technique where your long, easy breath out is during the exertion phase of the lift would be one way to minimize the intensity of the strength training. You can calculate your predicted maximal heart rate using the formula of the maximal heart rate equals 220 minus your age. So a 60 to 80% effort for a 40-year-old would be in the 220 minus 40 times the 0.6 to 0.8, or 110 to 140 beats per minute. You might want to split the difference and aim for a training heart rate in the 120s for this individual. Again, reducing the intensity for some can help reduce the odds that that exercise will provoke a migraine. And last but not least, among factors where exercise may affect your migraine would be exercise and the role of rest and sleep. Healthy exercise challenges the body to expand its limits on fitness, flexibility, strength, and endurance, but it does come at a price. In the best case scenario, the metabolic cost to power exercise and then repair and restore depleted resources breaks even, and we make gradual progress without paying excessive dues. But if we're already marginal in our nutrient resources or the hormone levels needed for repair, or if we have other underlying inflammatory factors, these shortfalls can both limit response to exercise as well as bring out the expression of underlying problems like migraine headaches. Obviously, attending to the applicable migraine root factors which can be stressed by exercise or exertion should be on our to-do list. When they are addressed, we promote the ability of sleep to do its optimal repair work. Some of these factors include A, having sufficient protein, magnesium, or B vitamins in the diet, or by supplementation if required. B, supplementing the nutrient CoQ10 if you're taking a statin drug for your cholesterol. And C, supplementing deficiencies in key repair hormones like estrogen, testosterone, progesterone, or your adrenal building blocks, especially if you are in the 30s to 50s age group and may be perimenopausal. This is especially important if hormone deficits and associated heat exchange problems are robbing your deep restorative sleep. We should additionally consider that pro-inflammatory factors like high levels of histamine or an excess of prostaglandins, particularly right before the end of your cycle, may be worsened with excess exercise. Still, if these are optimized or depending on your level of fitness, we do need sufficient time and sleep or rest to pay the dues incurred by the exertion of work, chores, and exercise. Most people, especially those of us with a chronic health problem, tend to underestimate the amount of sleep or relative rest needed to pay these dues. Summary Part 1. Questions to ask yourself about exercise and migraine. Look through the text in previous slides to review the details. Number 1. Minimize factors that could excessively boost your nitric oxide level. Number 2. Recognize that times of excess physical, emotional, and situational stress may require reducing your exercise frequency or intensity. 3. Consider taking nutrients that can reduce those peroxide ONOs and their downstream effects. These can include nutrients like curcumin, 500 milligrams, taking 1 to 2 caps per day, or optimal vitamin D levels. Make sure you're aiming for a blood level of 60 to 80, which usually requires 3,000 to 7,000 international units a day. And make sure you take those with a meal to optimize their absorption. And also astaxanthin, which comes at either 4 or 8 milligrams per day. Number 4, if your exercise leads to a headache, you might be a good candidate to try one of the newer drugs that block CGRP pathways. Number 5, if you have symptoms preceding a migraine attack such as excess sleepiness, food cravings, yawning, and fatigue, you may find it helpful to limit the higher intensity aspects of your exercise session that day and the next. Number 6, you may find that moderating either the aerobic workload to be in the 60 to 80% of your predicted max heart rate, or the intensity of weight lifted in strength training can both reduce the exercise to migraine link. Number 7, attend to any applicable migraine root cause factors that can be stressed by exercise or exertion, particularly see Part 4 above about sleep. And number 8, although it can be frustrating at times, it is important not to underestimate the amount of sleep needed to pay the dues incurred by the exertion of work, chores, and exercise. Then make paying those sleep dues a priority, no question. That's hard to do, but if you don't respect those boundaries, who will? Please plan to look for the upcoming episode 18, which is part 2, where we will complete our review of root cause factors that predict how exercise can affect your migraines. If you'd like to understand the broader range of root cause factors that drive your migraines and then individualize your therapy options, you may want to take a look at my comprehensive Natural Migraine Relief for Women course with its unique migraine action plan system. See naturalmigrainerelief.online for more details.